Health Minister Dr. Harshvardhan is in the eye of the storm, this time over his stand on sex education. In his vision document for Delhi schools on his website, the Union Health Minister says that so-called sex education in schools should be banned and that states must integrate value education with course content, laying emphasis on exposing students to India's cultural relations. Now remember, this comes just days after another controversy over his comments on combating AIDS, where he said fidelity will go a long way in combating AIDS. His statement was viewed by many as giving morality lessons for the cure of the disease rather than concrete steps to combat it. All right, we have got some reactions. We'll play that out in just a moment. But before that, let me quickly go across to ad filmmaker Alec Padamsee, who's now joining us. Mr. Padamsee, what do you make of the Health Minister's statement where he's advocating a ban on sex education?
Well, I think the Education Minister, I have to admit, in all honesty, is the most brilliant mind of the 15th century.
All right, you're saying we're going back in time if we go by the prescription of Dr. Harshvardhan.
What on earth is he talking about? Why doesn't he have a poll of all his ministers and find out how many of them are practicing what he preaches? I'd like Mr. Modi, our Prime Minister, to get a poll done of all the ministers and all the administrators in government and find out whether they are adhering to this rule that, there should be no sex education in schools and colleges, and that fidelity is the best way to to prevent AIDS. Really, I mean, I have a good friend who's an excellent psychiatrist. So if the minister in charge wants to visit him, I will arrange a free consultation with the psychiatrist. Check out whether mentally he is all there. Yeah?
All right, scathing comments there from Alec Padamsee on the Health Minister suggesting a ban on sex education. Please, Mr. Padamsee, please stay on with us. We also have noted filmmaker Onir now joining us on the phone line. Onir, just days after the Health Minister said that fidelity, in fact, was better than use of condoms as far as combating AIDS is concerned. Now he's talking about banning sex education. Do you think he needs to clear the air? Because last time around he said he was misquoted, but this has been picked up from his website.
Yeah, I think it's really, really disturbing. And it's not only about this ministry. It's been happening over the years. And it really angers me. Honestly, when I heard this today, I was angry. And despite me shooting, I decided I have to talk about it. Is that why, in a country where you have more than 60% of children getting abused, and it's been happening for decades and centuries, that as a government, we are eternally not addressing the real problem. We're not addressing the problem that children need to be protected. And
right.
Protection comes from awareness. By educating them, you are not educating them how to have it. It's idiotic to think that by educating them, you're making them have sex all the time. You're educating them to protect themselves, to know about what's a good touch and a bad touch. And when there is so many children who get abused in this country, by denying them, you are actually disarming them. You are not equipping them to protect themselves. And this is what really angers me, that because of this regressive, closed thinking, that you are actually, felicitating and continuing the process of children being abused. Why don't we really deal with child trafficking, child prostitution, instead of talking of something that actually empowers children?
Onir, I want you to stay on with us. We're also joined on the phone line by Anjali Gopalan of NAS Foundation. Ms. Gopalan, thank you very much. What do you make of this focus of the Health Minister on morality, on value education, on fidelity when it comes to combating AIDS? Do you see this as a moral cultural push while issues should be addressed as that of health when we talk about combating AIDS? Or this statement of the Health Minister where he's suggesting there should be a ban on sex education?
Well, I think I'm just hoping that the minister didn't realize what he said. Because the one thing we do know 30 years into the epidemic is what works and what doesn't. And the moral argument does not work. That we are very sure of. And I think we should learn to trust our young people. When you give them correct information, you give them age-appropriate information, they learn to make the right choices. So by taking that away from them, you're actually denying them the choice to live a healthy life. So especially as a doctor, especially as a health minister, for a person to say something so irresponsible is really very sad and a very terrible reflection on what we are doing to our people.
Right, and the first time around when his comments on AIDS were highlighted, he said his comments were twisted, they were misleading headlines, there was an impression that was made out that he was against the usage of condom. But this statement, which has been picked up from his website, where he outlines his vision for Delhi schools, doesn't it offer confirmation of his views?
Of course it does. And for anyone, especially, you're talking about giving information to young people. And he has it in writing. He wants to deny them this information. So I think tomorrow, this entire generation has the right to turn around and ask us why we didn't share correct information with them when we had all this information that would have protected them. So I don't know. I think the fear comes from a certain very twisted logic that if we talk about sex education, we are actually promoting promiscuity. But I think research has consistently shown us, and the minister must understand this, that where age-appropriate sex education has been in place, teenage pregnancy rates, sexually transmitted infection rates have fallen. So please learn to trust young people to make right choices.
All right, very important points there being raised by Anjali Gopalan of Naz Foundation, social activist there, pointing out that do not equate sex education with promoting promiscuity, because that is what seems to be the sentiment out of Dr. Harshvardhan's statement. In fact, he's gone so much on to say as much that there should be a ban on sex education in school. We have Zoran Cross, another social activist, joining us on the phone line. Mr. Cross, what do you make of the health minister's statement? Many social actors actually seeing this as some sort of a morality push by India's health minister.
Well, first of all, I want to know what sort of qualifications the person has, because obviously it's on medical if he's making such statements. For all you know, it's probably some honorary diploma he got just for the sake of political pull. Jokes aside, I personally think that not only is it backward, but it's also, derogatory in many ways, because banning the use of condoms, maybe he's pushing some sort of anti-homosexual agenda, because let's face it, that is one of the prime areas of the BJP, anti-gays and anti-women, isn't it? Secondly, on top of it all, as for banning the use of condoms, it makes no medical sense to do so. I mean, if he's saying it's promoting Indian culture, does he forget that Indian culture is the Kama Sutra, which is all about sex in more ways than one? As far as, teaching kids yoga instead of sex education, well, isn't part of the reason of doing yoga was because Shiva and Parvati were consummating the marriage, hence all the yoga asanas came into being? How's that for Hindu dogma?
All right, thank you for joining us. So these are the views being put across by social activists who are questioning the health minister's moral stand on issues which are related to not just combating diseases like AIDS, which should be treated as a health concern and not as a moral one, but also his strong views on sex education in schools. He has sought a ban on sex education in his vision document on his personal website. So he has no reason to say that he has now been misquoted or misinterpreted. So clearly, this interpretation of Harshvardhan as far as sex education in the country is concerned has sent a shudder down the spine of social activists. Let's listen in to some of the other voices.